All right. Hello and welcome everybody back to the Fit Pro Show. This is David here in Houston. Emily's going to be on with us here in a moment, but we have two special guests today. We have Elizabeth Moose, and we also have Megan Taff from the Palo Alto Health Center, and they're going to be on with us today sharing their expertise. It's always fun when we have some different perspectives on the show. And so they are the chiropractor and physical therapy out there. And what we're going to do is just kind of introduce them, get their backgrounds, and then kind of go into the similarities, differences, kind of their scopes of practice, all that kind of stuff. As we move along, please take in all the information and feel free to put anything into the chat box. You can unmute yourself along the way, anything like that, if there's a question that comes up that you want a real-time answer to. So as we get started, Liz, Megan, one of you just introduce yourself, give a quick background, and we'll get straight into it.
I'll go first. My name's Liz. I'm the chiropractor at the HP Palo Alto location, as David mentioned. So a little bit about me. I'm originally from Minnesota, so if my O's get a little long, don't be alarmed. I have been a chiropractor for almost 7 years now, and then with crossover for 2. So my background is I teach at a chiropractic college, and then I also have done a lot of training in sports chiropractic. And so I have the specialty of sports medicine.
And I'm Megan Taff. I'm the physical therapist at the HP Palo Alto location, so I work with Liz. I have been a physical therapist for 17 years and have almost solely practiced in outpatient orthopedics, sports medicine during that time. I'm also a strength and conditioning specialist, as well as a USAT triathlon coach, and I also compete myself. And I'm originally from St. Louis, so I'm kind of used to thinking about Central Time Zone because I'm always, texting or calling my parents or whatever. So.
Oh, nice. Awesome. Didn't know that about y'all. Great. Well, thanks for sharing. It's always nice to start out with something like that, so we kind of have an idea of who you are, what your background is, stuff like that. But I think the first overarching question that I have is, what are the two practices? What does it mean to go into physical therapy or to see a chiropractor? So you both can do just as you did right there. Elizabeth, you can start us off and kind of just give us, I know that's a big question to start off with, but just a general what your practice is.
Yeah, thank you for that question. So in general, PTs and chiros operate pretty similarly with a few key differences. But like in general terms, spine is usually more chiro, extremity is more PT. However, both of us treat both things. Sometimes we've talked a little bit about like acute care versus chronic care, who's the better provider to see. But ultimately, when you're working with a sports chiropractor or a rehab chiropractor, it's kind of just your preference, whether or not you like PT or chiro. And if you're in the Bay Area, Megan and I love treating together. So usually we'll encourage you to see both of us at the same time. So it's kind of patient preference.
Yeah, and ultimately we're both, musculoskeletal professionals, and so we're used to dealing with the body as a whole. Both of our philosophies are fairly similar in that we treat the person as a whole versus just seeing like, hey, I have low back pain, or hey, I have shoulder pain. There's a lot of other extenuating circumstances that surround injuries and someone's overall health. So we try to take that into consideration. And working for a company like Crossover is great just because we do have other medical professionals that we lean on, in addition to the phys med team, which is comprised of, Liz, chiro, me, PT. We also have behavioral health coaching, primary care physicians, nursing, and things like that. So we're able to kind of treat the patient very holistically. So it's just a wonderful opportunity for us to really just take care of our patients on a different level. But yeah, definitely Liz and I are a great team, and we love to work together. And I feel like when we work in conjunction with each other, our patients just get better that much faster.
Yeah, that holistic approach is certainly something that our fitness team on HP tries to do as well. Within our team, using our registered dietitian, using the health center folks, which is exactly why we want to collaborate with y'all today. So I'm really glad to hear that. And I don't think a lot of people really knew that about, one focusing a little bit more of an emphasis on the spine, maybe another one on the extremities, like you said. So that can probably be eye-opening for some people on today. And so getting into it just a little bit more, what are some of the common issues that you see with your clients when they come in? What are they dealing with when they come to you? I'm sure there's a broad spectrum of those, but maybe there's some that you see over and over again.
I can say for chiropractic, what has kind of been fleshed out a little bit in the research is that most commonly people come to see us with subacute or acute to chronic neck and low back pain, and then headaches tend to be the main reasons why people come and seek out chiropractic care. I'd say,
Liz, you went on mute.
sorry. I'd say our center is a little bit different. We have a pretty active population with HP. And so, we see a lot more of like the weekend warrior type of, maybe injuries or nagging, things that pop up. But we're really just focused on like, how do we get you back in action, whatever action is for you.
Yeah, I would agree. I mean, you always have your basic, general orthopedic type things that walk through the door, rotator cuff tendonitis, neck pain after having a car accident, low back pain from, picking a kid up or something like that. I mean, those things are going to be out there, but ultimately, I think, just with our general population, we kind of tend to run the gambit of, injuries. We also have a lot of, hey, I'm working from home. Obviously with the pandemic, we've seen kind of an uptick in things that are related to poor setups because of workstation kind of inadequacies, not having the access to some of the nicer work chairs and workstation setups that people typically had when they used to go into the office consistently. So I know Liz especially has really been spearheading a lot of our workstation ergonomic type interventions. And so I was always very happy to lean on her during this whole process, because that was always part of our treatments. Not only what are you experiencing, what are your injuries right now, but how can we help you as far as biomechanics at home when you're working from home.
That's great to hear, because we've had Phil Beadle on before talking about ergonomics and how to set up your workspace, because when people realize that it's not what you do that 1 hour while you're working out or getting treated, but the other 23 hours as well, having that alignment, not having that pain and dysfunction just because that head is tilted forward or whatever it may be, all down the line.
Yeah, it's hard to undo 9 hours of bad habits with just 30 minutes to 1 hour of exercise.
No kidding. And as much as we try to mobilize and activate those key areas, yeah, there's only so much you can do. So that's interesting. Okay, so
also
yeah.
on that, I think that's like one of the biggest parts of the puzzle piece that people forget about too. Just talking with Phil and, hearing his experience with clients. I think a lot of people don't think about that part of the puzzle. And so if that's something that you haven't explored yet, to everyone who's listening, feel free. Phil has left, but Stephanie Brunson has just taken his place. And so we're going to be putting out more of her content in our e-newsletters, trying to incorporate her more and a lot of more of our programs that are coming up. But if that's something you're interested in, just know that that is a service that we have for you guys to go out and have an evaluation done, have a consultation be done, and figure out maybe if that's the puzzle piece that you're missing. So just wanted to throw that in there.
And one of the things with ergonomics is like, it's absolutely very, very important. But even having the perfect setup is still inferior to getting up and moving. And
Absolutely.
so making sure you take those micro breaks, taking some time to stretch it out. I know that like, as an exerciser, like if anything less than 30 minutes, I'm like, did that exercise really count? But if you look at like the ACSM guidelines, they're not saying like you have to go out there and jump in these chunks of exercise. It's total minutes. And so I was lucky enough to get on to hear one of the ACSM leaders speak, and she called them the exercise snacks. So one, it's good for workplace productivity, and then also just really great for your body, to get up, move around, and then find little ways to enter or insert that exercise into your daily work.
And I think our team
Yeah,
is
definitely. That
really
was
good
one
at
of
that with Cube
Phil's
Fit,
biggest
right?
things. Yeah, definitely. And that was one of the biggest things Phil preaches is like your best posture is your next posture. So get up, move around, switch places. And he always goes by that 28-2 rule. So 20 minutes seated, 8 minutes standing, 2 minutes of moving. If you can put a timer on your phone for that 30-minute mark and do that every time, I mean, you should be in some good shape. But yeah, I like that topic. And that's something that I like to preach a lot because I think it's a big piece that a lot of people miss.
I first heard that exercise snacks comment by Jason Taglay on our team. So I love that you used that because the first time he said it, I like noted it because it's just so perfect. Okay, good information so far. Emily, did you have any burning questions that you wanted to ask our guests today?
I mean, we kind of went over like what was like kind of the top injury or complaint that you guys kind of deal with. Um, I would say one of the other questions is like, okay, where do you start? I worked with a chiropractor. We didn't do traditional chiropractic work. We did kind of muscle tissue treatment. But the biggest thing was we'd have people come in and, they tried this and this and this, and they've been dealing with it for how long. And so the biggest thing was like, okay, I have this pain or discomfort. I have this issue. Where do I start? What do I do? And that's kind of where they were lost. And sometimes they wouldn't do anything because they didn't know what to do. So I guess for your services and what you guys do, what would you say is like the first step?
I would say step number one is of course asking for help, and you can begin with any professional. And that's the cool part with crossover is that, you could see Liz first if you wanted to, and she can make a referral to me if she feels like it's more up my alley, and vice versa. Also with our primary cares and our nursing staff, they're all well trained and kind of knowing like, hey, this is something that's more orthopedic related, so I'm going to actually send you to the phys med team versus having you do a physician visit. So the biggest thing is just asking for help first and foremost, because we can always direct you in the right way. If it happens that, we end up working well together and we stick with PT, hey, great. If we find that we need to add in another modality, maybe chiropractics, hey, great. But we have a lot of leeway as far as, how to begin. And a lot of it's based off of, again, personal preference, maybe past history. So have you seen chiropractics before? Have you seen PT before? But ultimately, the number one thing is just, ask for help.
Yeah, definitely. I agree with that. And just kind of, knowing that you guys are very understanding and that they're not gonna, you're not gonna keep somebody in a service that's not good for them.
Right.
I think that's one of the biggest things that I heard from my clients is like, yeah, they kept me in chiropractic for 6 months and it wasn't doing anything. And it's like, well, you probably should have known by those 6 months they need to move on if they weren't referring you out. So yeah, that's great to hear.
Yeah, Emily, I think you bring up a good point. So one, if you ever aren't vibing with any of your healthcare providers, find a different one. You should have that trust. And I know we're talking a lot about the health center because Megan and I are lucky enough to work very, very closely with Palo Alto, the Palo Alto campus, but I know that not every HP location has that same access. So just kind of a quick, where to start. Laws differ state to state, but chiropractors are always portal of entry. So you can go into a chiropractic office without having a referral. Many states have direct access to PTs, but they might have a limited number of visits they're allowed to treat you with before you have to have a referral in. And so just kind of check it out where you're at. If ever you're curious about, how to find a good provider for you. I can't speak for Megan, but my email is elizabeth.moose@crossoverhealth.com. You're always welcome to send me an email to be like, I live here. How do I find somebody? But places that I like to usually look, especially since we're on a fit podcast, there is a designation called the CCSP, which is a Certified Chiropractic Sports Provider. I think they're a really good place to start if you're, like to exercise or if they're a rehab specialist, I think is a good one for the fitness community. There's a lot of different specialties out there within both PT and chiropractic. So you just read the website and you can kind of tell if they're the right vibe for you. And if you walk in and you're like, this is not what I thought, it's okay. You don't have, no one's making you stay.
Yeah, definitely. I love that because I've definitely come in contact with clients in this job and previous jobs where it's like they have this fear of even going to somebody else because they were trapped in that relationship they felt. And it's almost like that fear of like, well, I don't want to go see another person because the last 5 people didn't help or they kept me there and took a bunch of money from me, whatever the case may be. So yeah, finding those trusting relationships, and those are some great resources to check out. Thanks for that.
So if somebody does take the plunge, because there's so many places you can branch out, so many different emphasis, it sounds like if somebody does take that plunge and they say, hey, I want help, they make an appointment, what does that typical session look like? Maybe there's somebody on that is just a little apprehensive about taking that first step and they want to know kind of what it'll look like when they get in, either in a virtual session or an on-site session. What can you run us through what that might look like?
Typically, we're going to start with a very, very detailed subjective history component. Ultimately, you're kind of a culmination of all of your injuries that you've had in your life. So I tend, and I know Liz does as well, I tend to get very detailed as far as, hey, what's happened to you throughout the course of your life, not just with this one thing you're coming in for, but what has happened to you in the past. So ultimately, once we have all of that information, and it could be something even like, hey, have you had surgeries? What's kind of going on there? Again, all of these things affect what's going on with you now. And once we have all of those pieces of information, we can go ahead and start to get into the objective examination, where we start to look at the specific things based off of what your complaints are. And obviously, and I won't speak for Liz 100%, but I know we just kind of work very similarly in that, it's not just always like, hey, I'm coming in for shoulder pain, I'm just going to look at the shoulder. There's other components that feed into shoulder pain, be it something coming from the neck, something coming from the mid back or the shoulder blade. And then even sometimes too, things like, hey, my core is super weak. I had, a C-section a couple of years ago, after having my kid or whatever. So my core is super weak. So there's other things that we look at in addition to the exact thing you're coming in for. But then ultimately, once we're finished with that, we take all of that information and then we, just have a discussion with the patient. We say, hey, this is kind of like, what we feel is going on. Let's kind of get your thoughts on like, questions that you have. I'm a big fan of like Google Images. Back in the day, we used to have like big old skeletons in the clinic where, you could kind of point stuff out, but now it's very much so between the virtual visits and the in-person stuff, just, relying on, the laptops and the computers to kind of help us out with that stuff. But then ultimately, once we, kind of chat and hopefully the person has a better understanding as far as what's going on, we can talk about treatment options. And then ultimately we move forward with whatever the patient feels is most comfortable, what they're most comfortable doing.
Yeah, that's pretty much everything that I do as well. One thing that I'd just like to kind of let the audience know is that often we're all experts at compensating. So our bodies don't like to feel pain, so we're constantly making these little changes to the way we move. And oftentimes when we hit a point of pain, it's not always that is the area that's the problem. It's just maybe the weakest point that hasn't been able to kind of maneuver away. So sometimes it can be a little weird because you're like, I'm coming to you for wrist pain. Why are you talking to me about my neck? Or, my knee pain. Why are you looking at my hip? I think hopefully your providers are like explaining their thought process as they're going, going through. But yeah, if you're ever like, why are you doing that? It's always okay to ask too.
That's one of my favorite things that you both spoke of, because I feel like that was something that I always had to explain to people, and still now too, talking about them. Well, hey, if your knee's bothering you, have you thought about foam rolling your quads, your hamstrings, your glutes, calves? Like, you got to think about the body. It's the whole chain. So, and it's cool to have them like realize that, and they have like this big light bulb that goes on, and they're like, wow, that makes a lot of sense. But yeah, I think to your point, if you do have those questions, don't be afraid to ask that. I mean, it's very important to understand, yeah, if you did go in for wrist pain, why are we looking at the shoulder or the neck?
Yeah, it can all be kind of nuanced, and it can be surprising when somebody comes to you with a certain problem and you find it in another place. I know we've talked about that here on this show, how the body should move as a kind of synergistic unit all the way down. And so that's really interesting that you brought that up. I'm glad to hear that. So somebody comes in, they're getting treatment from one of y'all. What kind of results or improvements can be expected from that? Obviously, you both want to relieve some of those compensations, the pain, any function, any dysfunction that's going on. So what can be expected if somebody's coming in with, like Emily said, neck pain, wrist pain, whatever? What can they see from an improvement standpoint?
So ideally, we love to see positive outcomes right away. And, sometimes we're lucky enough to do that. Or skilled maybe. But also when we're going through those exam procedures that Megan mentioned, our goal is we're taking the things that you told us about your movement story, and we're trying to push and poke you in all these positions to see if we can elicit the pain that you have to tell us where it's coming from. So sometimes you may not feel better right away in that first visit. Maybe you feel a little sore, almost like you had a really hard workout for, a couple of days afterwards, because we're pushing and poking you in the areas that you're going to be sore. But typically I will, like, if my language to patients is like within 3 visits, I should see some type of improvement. And if I haven't in those couple of visits, it's told me I either missed the diagnosis or I'm not the right provider. But most people find some type of benefit within those first couple of visits.
Yeah, usually I am kind of a fan of like 3 to 6 visits, but my goal is to find at least one thing to make an improvement on at the very first visit, and then I kind of work from there. I do a lot of pre and post testing. So, we'll just say for the sake of an example, like, shoulder range of motion, if you can't raise your shoulder very high, I'm going to work on some things and try to get that, even if it's just a few degrees better. A lot of times that can just really help out with any discomfort that you're feeling. So, I kind of work on those, little bits and pieces as we go along, and it's kind of, it adds up over time. So, maybe one visit we see like a huge change, and maybe one visit we see a small change, but, ultimately all of it adds up into kind of the end result, which is, getting that shoulder pain resolved.
Yeah, I think Megan made a really good distinction there too. So while we might not always have subjective changes, we are always chasing those objective changes. So maybe a change in how your range of motion, as Megan gave as an example, maybe we have you, retest one of those tests that we did. So while you may not feel better, hopefully you're leaving with some evidence that it is working.
Yeah, it's usually your body, you kind of see those changes maybe sometimes before you feel. It's always nice when you feel and see at the same time. And we're lucky in some ways because, a lot of times that can happen together. But a lot of times it's more of those objective findings, the things that we're seeing. But I try to show each patient too, like I'm a big fan. I use mirrors constantly because you need to be able to see how you're moving, number one, because that's going to help your brain start to connect to whatever it is the faulty movement patterns are. And we need to break those patterns. So then, you can kind of see where the faulty movement is. And then as we work through it during the treatment session, you can kind of see what happens pre and post, and you can see that difference. Like in my own private practice, I use a lot of like videos, pictures kind of before and after. So that way the patient has like hard evidence. But, when I'm doing it kind of things in real time, I like to just stand in front of a mirror when at all possible to show kind of those differences in real time.
And most people can expect that we're going to be giving you some sort of homework. So Megan and I mean, I'd love to think that we're amazing and can do everything. But as the comment happened earlier, like we're only with you with this really small amount of time. We're more your cheerleaders and coaches on your journey to health, to better health, and not the ones that are going to give it to you.
Unfortunately,
Yeah,
you guys still have to do
absolutely.
the work.
Yeah, right. There's always homework.
Yeah.
One of the things I kind of just thought of, you guys had both mentioned kind of like your intake process of, finding out, asking those questions, what surgeries have you had before, other injuries, all that. What's your take on talking about like stress, diet, sleep, when it has to, do with pain and discomfort?
There's a very real connection with, chronic pain and all of those things you just kind of spoke to. And so ultimately, in the past, probably, year and a half or so since we've been, kind of in the process of COVID, we've had a lot of research that's come out. And we've had a lot of continuing education opportunities to go over that research about the connection and kind of more terms like pain science. So why is it that someone continues to have pain even though maybe there's no tissue damage that's actually occurring? And so that's been really fascinating to learn about in more depth over the past year and a half. And so all of those things are very much so part of our conversation. And then again, because we work at Crossover, we're very lucky in that we can utilize like our mental health providers, our health coaches, and various other providers to help us out in that process at the same time. We also have acupuncturists and massage therapists as well. So, all of those things, related to stress and sleep disorders, while I can speak to some things because I know about some things, I am not an expert in those areas. So I do make those referrals as necessary.
Yeah, exactly. In private practice, it's maybe something that I would talk about a little bit more in terms of like nutrition, but we've got such an awesome nutritionist, and I know that you have it. We have a nutritionist through the health or the fitness center as well. So there's other experts out there. I don't need to lend my C knowledge when we've got an A+ provider. But then also when it comes to like the mental health stuff, sometimes also just teaching our patient slash members like how to kind of manipulate their mental health through their body. So maybe it's teaching some diaphragmatic breathing, which is also going to help your core, which is also going to help your mental health. So just kind of using the body to influence it backwards.
Yeah, definitely. Yeah, I've seen just in myself and other clients too, how much that affects kind of your pain and discomfort levels, and how much, it does have a piece to it. And I think it's great that you guys both understand that and have that conversation. And then, from that conversation, if you need to refer out, you guys can do that. That's great.
And when you tackle it like that, everything together, it kind of gives everybody a better chance to become an overall healthier person when you have that culture of health and you have multiple professionals, A+ professionals, like Elizabeth was just saying, helping you out. And I think they were talking about how you're always going to have homework, whether it be from, your personal trainer or your chiropractor or whatever. How do you get people to adhere to the homework or the programs, or kind of lend a hand in helping them adhere to the protocols? Because in kind of a hierarchy of what's important, I think that's certainly way up there. So do you have a best practice for that?
It can be a tricky thing for some folks. Obviously, it's one extra thing added into the course of your day, but kind of going back to a lot of like the pre and post testing that I do, while I definitely, there's a component of me doing something to you as, obviously a physical therapist, but, virtual kind of changed things quite a bit. So I had to flip the script and actually make the patients more of the doers versus me doing something to you. You had to do it to yourself. But this is still kind of like the same way that I operate pre and post testing. So if you see like, hey, my shoulder hurts, I can't get my arm all the way up, and then I do something and it makes a change, and all of a sudden my shoulder's like way up here and it doesn't hurt anymore, I think that's going to be very much so, it's going to show you like, oh, hey, I made this change in my body. I'm going to do this exercise because guess what? It made me feel better instantaneously. So those are the things that I kind of look for within each treatment sessions. And, not everyone is a win every single time, but I try to look for those 1 to 2 things that I know is going to make a change and that patient feels the change, because then they're going to be definitely more likely to adhere to that program. And I don't try to overload people with like 20 exercises. It's usually just anywhere from 1 to 3 key things that I give someone.
Yeah. And then I usually like, just to add to that, pretty much all the same thing, except for I also like to start with the things I know feel really, really good, to play to that psychology part too. So if I can get you feeling really good with the, a stretch or, cat and a cow or something, then when I start to ramp it up and get into some exercises that maybe are a little less comfortable, but still, even more beneficial, then hopefully we've built up enough trust that you're going to do them.
Yeah, small taste of those results can go a long way, no matter what you're chasing, right? And kind of get you hooked. So that's really cool. Throwing 20 different exercises at somebody or 20 different cues at somebody, usually 0 are going to happen. If you
Right.
throw 1, 2, 3, then you can probably get some of those to happen. Awesome. Well, it looks like we're already at time, man. That flew by. Thank you so much, Megan, Liz, for joining us today. That was super informative for me. If it was for me, I'm sure everybody on really appreciate it too. Emily, anything you want to add before we get out of here?
No, I think everything that we talked about was really insightful, and I love hearing, your best practices and whatnot. And maybe if we have more attention to something else in the future, we can have you guys on. I don't know, get into
Absolutely.
something more specific. But yeah, it was great having you both on. Really appreciate it.
Thank you for having us.
Thank you. And if anyone ever needs, has any questions for us, our emails are first name dot last name at Crossover Health.
Got it. If everybody enjoyed this episode, then come on next week. We have our registered dietitian, Jessica, on, and we're just providing all the great information and all the great guests recently. So same time and place. We'll see you next week. Thanks, everyone.
Thanks,
Thank you,
everyone.
guys.
Thank you for having us.
Yeah. See you guys.